Welcome to the podcast, Dr. Melillo. Very, very happy to have you here today.
I'm excited to be here. Thank you.
Yeah. So let me give you some context of the listeners. Ayurveda. I think we've spoken a couple of times. So these are parents of children between the age group of 3 to 12, mostly 3 to 10, I would say. And I would say the maximum of them belong to the age group between 3 to 5, 3 to 6. That is the time when they are figuring out different interventions. So particularly because you have this method that you work on, while your method works on all age groups, I think if you can respond to questions keeping that early intervention or that early age group in mind, that might help the parents a lot. So let's just start. Why don't we first start by your introduction, Dr. Melillo?
I'm Dr. Robert Melillo. I'm a clinician. I've been a clinician in private practice for almost 35 years. I have a PhD in developmental cognitive neuroscience. I have a master's in clinical rehabilitation neuropsychology. I have a doctorate in chiropractic medicine with a specialty in neurology and rehabilitation. And I've also, been a postgraduate professor of development and developmental neurology and neuroimmunology for 30 years. And I still teach. I'm teaching a course this weekend. And I head up a brain research lab. I've published over 100 papers. I have textbooks and I have 8 best-selling books. We have 2 centers here in New York that we work with, all different ages, as you said. But again, the majority of our patients are in that probably 3 to 12 age. And especially one of my areas of research is looking at something called retained primitive reflexes, and also what actually is the root cause of these neurobehavioral disorders, and questions like, what actually prevents them from speaking. And we work with a lot of non-speaking individuals.
Yeah. I think the last point that you mentioned is extremely important because most of the parents who are extremely worried about their children are those who feel that their children are yet not talking.
Yep.
So I think we will touch on that and we'll go deeper. Let me first start by asking you a very simple question, but I think it's extremely important for the parents to understand. Even I want to know, what is autism?
Well, it really starts, as almost all neurobehavioral disorders do, with a gift. First of all, it's not a brain injury. There is no damage or injury to the brain. There's no pathology in the brain. We've studied, we've published a lot of research and done brain imaging. And, when you look at the brain of a child with autism, a typical, and again, there's 2 different subsets. One is called syndromic, and those are children that have a genetic mutation like Down syndrome or Fragile X, but may also be labeled with autism. That's only about 5% of the population. But 95% do not have any genetic mutations. So it's not because of a genetic mutation. It's not because of a brain injury. It is there is a difference and an alteration in the normal growth trajectory of the brain. And it starts with that people that are on the autism spectrum typically are gifted, especially with their left brain skills, that they advanced and very powerful. Normally, the right brain develops and takes the lead in the first 3 years, and then the left brain comes online. And that sequence of development and how it happens, especially in humans, is critically important to our brain development and function. And what we've been able to show in research is there's a maturational delay and alteration that creates a developmental imbalance in the brain, where areas of the left brain come online too early and too strong, and it suppresses and regresses the development of the right side. And then that equates to all of the symptoms that we see, which things like OCD or hyperactivity or repetitive behaviors or tics or stimming or anger outbursts. Or overactive areas on the left, along with not feeling their body and maybe doing self-harm and not really connecting with other people and not pointing and not really being able to regulate their emotions. And, and also, primarily that's the reason why they don't speak, is not because of a problem with left brain language centers, as most people assume. And that's important, because if you don't know, first of all, what I just went through, most parents that are out there, nobody has described in any way to them what is actually happening in the brain. Nobody.
Yeah.
And that's because most people don't know it. They give it a label. They say, this is what your child has, and they fit these diagnostic criteria, but they don't explain what is happening in my child's brain. What is producing these behaviors, and why don't they speak? No one's ever really answered that, even in research. I've published a paper on it, and I think, I've spent 20, 25 years really trying to answer that question, and I believe now I've answered it at the level that no one else has. And that's important because, as you said, the biggest thing for parents is they want their child to be able to speak and communicate. And let me tell you, we work with a lot of these kids, and they can actually communicate on a letterboard or with devices, and they know so much more than we think. We know that they're brilliant, and they say, I want to speak so bad. That's what they want. So you're not going to be able to do that if you don't know what is actually preventing them from speaking.
Yeah. So what is preventing? So let me rephrase it. Now, I think you've given me a lot of context here. And as a parent, if I were to ask the next question, I will say, what causes speech delay?
Well, again, speech delay can happen for different reasons, and it could be because of a delay in the left side of the brain or in the right side of the brain. So what we typically see when a child's 3 years old and they have a speech delay, they kind of all get an autism label, even though some of them may end up being the exact opposite of autism. But to me, when there's a language delay in autism, it really starts with what we call a nonverbal communication delay, meaning that they're not pointing at one. They're not pointing. They don't have that connection. They're not approaching other people. Their eye contact may be less. But really, the pointing is a key thing. Kids who have left brain delays and verbal language delays from the left side, they usually have a great nonverbal communication. They have great eye contact. They're pointing early. And that's one of the ways to differentiate that, because some kids that have language delays may end up having more of a learning disability, or a dyslexia, or dyscalculia, or a left brain problem, or an ADHD type 1. And later on in life, maybe bipolar or depression. Whereas kids that have right brain delays that aren't pointing and aren't speaking, or lose that ability at some point, they may go on to be, labeled with ADHD or autism or OCD or tics, or, ultimately things like, possibly even schizophrenia, psychosis, and many other mental health issues as well. So there's a big difference between that. But with autism in particular, the reason they're not speaking is because they don't feel their body. When we're developing, as we move through the world in a typical way, we take input from our body, from our muscles, from our spine, from our inner ear, from our eyes, and we build a 3D map of our brain. And even earlier than that, it starts with something called interoception. So our research, we published papers on this in the last couple of years, showing that kids that, especially non-speaking kids, most of them have a significant alteration of interoception. When a baby's first born and that right brain is first developing, there's an area called the insula, where a baby needs to tell the parent when they're in pain, when they're hungry, when they're thirsty, when they're tired, when they need to go to the bathroom or be changed, and when, and that is related to smell and taste. And we see that most of the kids, especially in the non-speaking end of it, they have very, very low interoception. They don't really feel their body, and then they don't build what's called exteroception. They don't build a 3D map of their body in their brain, first a sensory map and then a motor map. So they don't, just like most of these kids don't point, and they lead people by the hand, and they use other people's hands to do things for them because they don't know where their own body is. And that's the reason they don't speak, not because they don't have the words. In most of these kids, the words are all there at an advanced age, even though they really don't have a good way of showing that.
Mm. And you mentioned an imbalance in the first question when you were answered. You touched upon the word imbalance, and I know you work a lot around brain imbalance. And
Mhm.
you mentioned that many disorders stem from brain imbalance, which is the left-right brain imbalance. So, what is brain imbalance?
Yeah, I think almost all disorders, mental health disorders, childhood disorders, other than genetic or true brain injury, almost all the other ones really are due to some sort of imbalance in networks in the brain. And so a brain imbalance is a simple term. From a research standpoint, we refer to it as a functional disconnection. And what we know is that, going back to the late 80s, early 90s, when we really started studying the brain and could look at the brain, that there isn't usually injuries or specific lesions, or chemical imbalances don't really exist. They are really functional imbalances in the way networks develop and communicate with one another, and the way they share information. And one of the unique features of the human brain is that we have very different right brains and left brains. We have very lateralized brains, and that's a great advantage. It's essentially we have two brains in one that can operate in parallel, which is great. Like, for instance, when we look at attention, the left brain has a very focused, detailed, narrowed attention that's hyper-focused and short-term. The right brain has more of an open, sustained attention. And both of those, like if you think of an animal where a bird may need to look for a seed on the ground amongst pebbles, and it takes a very highly detailed, focused attention to be able to find that. At the same time, the right brain needs to be looking for predators that might be attacking. And you need to use both at the same time. If you didn't have two hemispheres, you couldn't do that. We need to be able to have verbal communication and nonverbal communication at the same time. So the brain should work in a flow and cooperatively. But if what happens is the way the brain's growing or developing, if it's delayed or if it's altered, or one side gains too much too soon, they now also are competitive. So they're competitive and cooperative at the same time, and they keep each other in check. But if one side gains too much, or if certain networks on one side overpower networks on the other, then this imbalance is what leads to overactivity of certain functions and underdevelopment of other functions. And depending on what they are and where they are and what networks, and there's, thousands of different combinations, that's what we call autism or ADHD or OCD or depression. And the way I look at it is really from a neuroscience and a neuroanatomy standpoint. Like, what is depression? The left brain generates joy and happiness and pride. The right brain generates emotions like sadness and shame and guilt. If we have too much sadness with shame and guilt, we have too little joy and pride. That's the definition of major depressive disorder. And that's the way I look at everything. I can show you networks and areas and specific parts of the brain, and mixing and matching in those, that's what makes, and so that's what a brain imbalance essentially is.
Yeah. I think I have a doubt here. When you were explaining more about non-verbal communication, why children are more non-verbal, why does that happen in autism? And we know that in autism, and I've seen your work on this, that the left side is very, very strong, and that's rightly so. We see children with very high IQ, they're intelligent, but but at the same time, the right side hasn't developed at the same pace. So there is an imbalance, there's a brain imbalance. But can you help me understand again, why are we saying that the verbal communication isn't at par? Is it because while all the prefrontal cortex, everything is strong, but the language part, which is in the right brain, hasn't developed much?
When, as I said, when we move through the world, first of all, to allow us to do that, the human brain is unique. We have the largest brain per body size of any primate, but because we're bipedal, we have the smallest birth canal. So we have really big heads for babies and really small birth canals. So we had to develop a way that we would restrict brain growth in the womb so that our brain would not grow too fast because it's already barely getting out. So when we're born, our brains are the most immature brains pretty much of any animal on the
Any
planet.
mammal, yeah.
No other animal really has to worry about those things.
Yeah.
And this is regulated by the genes that develop our brain, which are 84% of all of our genes in the genome are just there to be active during brain growth and development. And so they're very sensitive to the environment, and they can tell when we're in the womb versus outside the womb. When we're outside, they're bombarded with sensory input that turns them on. But this needs to be initiated through movement. But the part of our brain that would move us, our motor cortex, isn't developed at all. We don't have control. You know, a horse, for instance, will be able to run in less than 2 hours after they're born, and we at best won't walk for 1 year. So when our brain is born, it's only about 20 or 25% of its adult size, and it will get to the 90% by 3. So what we see is that 75 to 80% of the growth of our brain occurs outside the womb. No other animal has that. And it's a very long period of growth. I mean, our brain is still developing until we're probably 50, actually. So what we see is that there's a lot that can go wrong there. And anything that alters how we're growing and developing the brain. And that's where looking at these milestones are so important, and they're being ignored now. And many doctors are saying, well, you know, we can build children can develop at all different age. That's completely untrue. The brain is one of the most sophisticated things in the universe. It needs to be built in an optimal way, very specifically, and going through these milestones. And what takes us through them is what we call primitive reflexes. These are neonatal reflexes that allow us to move, engage our senses, build our brain until we build a motor cortex that we can take over. So the brain builds from the bottom up. And as we're doing that, and as we're moving through the world, we use input, as I said earlier. And first we develop this interoception, the ability to connect to our body and become an individual person. The first reason why we want to speak and why we are driven to converse, have a conversation, is because of that we want to attach to other people. The right brain, its main goal is attachment. And so that is the first part. So the drive to speak, first of all, is right brain, just like the drive to attach and connect with people. But then we build a connection to our body, and then we build these maps. And the biggest part of these maps, this is called a homunculus. You can Google it, and we can see the map in our brain. And our right brain has a whole map of our whole body. This is when we become a whole person. The biggest part of the map is our face, our mouth, and our lips. They're huge, and our tongue. And then our hand and our finger. That makes up like half of the whole body map. And so what we know is that these kids don't have normal interoception. They're not developing that area of the right side of their brain because their left brain is suppressing that. And they don't build these maps. So they don't know where their body is. They don't have the drive to communicate. And they literally tell us, I don't feel my tongue. I don't feel they type this to us. And they can't point where you want them. That's one of the reasons why they don't point. So, but all the words are there generally, like more than we even know. So they don't speak because of the right brain delay, not because of a deficit in the language centers of their brain. they will develop what we call a dyspraxia, which means they can't move their mouth and their tongue and speak. But it's not because of a primary motor problem. It's because of a sensory problem. If you don't feel and you don't create a sensory map, you won't create a motor map. I first have to feel where my body is. I have to know my hand is here, and then I can move my hand to touch my nose. I know where my body is in space. They don't feel that.
Understand.
And that is the reason why they don't speak. And most people, nobody really understands that, really. And most people assume that the reason they don't speak is because of a left or a problem in something called Broca's area. And that's completely wrong. And that area, Broca's area, in the left prefrontal area, is right also above and adjacent to the same area that's overactive that causes tics and stimming, and the same area that causes OCD. So many people go and they try to do different direct brain stimulation with a laser or with electrical devices or magnetic devices, and they try to stimulate that area. And not only do they not get speech to come on, but they make the OCD and the tics worse. So that's why it's important to understand why they're not speaking. And literally these kids tell us these things.
Yeah, very, very well explained. And you touched on this word called brain stimulation. Actually, my next question was on that is autism reversible with the right brain stimulation?
Yes. We have many children who have completely lost their autism label. We have also, the majority of those that come to us that can't speak at all, usually within a year can speak to some degree. And those that can't speak still are able to communicate in really sophisticated ways, so that they can actually start having, like conversations with those around them, and they can start being taught how to be able to learn and answer questions. We have one child that was 12, came in about a year and a half ago. He started with a home virtual program. And when he first came here, and this was a child who has never said a word and would really get violent and aggressive at times, and bite people and attack his parents, which again is not something that he wanted to do. He just could not control his bodies and impulses. And when he came, they didn't think he knew one letter. And when he came, he started typing with a letterboard, and he was with us for about 3 weeks. By the end of 3 weeks, he was completely conversational. It was unbelievable. And then the parents started doing this with him at home, and they wouldn't do it with him in school. They refused to. So the mom got somebody to homeschool him. And now he went from a year and a half ago, they weren't teaching him anything. And now he is fully fluent and is able to learn at a 6th grade level in everything. So amazing. He's actually, we now realize how brilliant he always was. And he no longer bites or anything. As a matter of fact, on my Instagram, we did an interview with this young man and his family. And if people go on that, they can actually download that and see that interview. It's pretty amazing. But
so I'll get it shared on our Ayurved channel. Yeah, of course. Yeah, this is amazing. Actually, I was about to ask you this next question, which links to the parents themselves. That, I mean, you have worked with thousands of children now. What do you think? What is the biggest mistake that parents make when they're trying to fix their child's autism?
Yeah, well, first of all, obviously, nobody likes that term of fixing. We want to improve. All we're trying to do, we're not trying to change or fix anybody. We're trying to get them to become the best version of themselves. And because of these things like retained reflexes, and because of these imbalances, and because they're so good in certain areas, that is one of the contributing factors. And then this also has the impact, as we'll talk about, on their body, their digestive system, their immune system, and that creates all these other things going on in their body. They're not the best version of themselves. And all we're doing is try to release all this stuff that's holding them back. and really just kind of bring them out. And so I think the biggest mistake, which is, and it's understandable because, this can be traumatizing to the child. It's traumatizing to the parents. It's very difficult. And I have nothing but full understanding. And many people are told from the very beginning, there's nothing you can do about it, that just learn to accept it. That's all there is. And so I understand that some people, they have to get to some level of peace in themselves. And they might just say, okay, then I'm just going to accept it. I'm going to come to peace with this, and I'm not going to do anything. And I understand that. I understand the feeling, and I'm not judging anybody, but I think that's a mistake. That, I think that I know there's a lot more potential, and I think that, although I completely understand it and have compassion for it, and it's not their fault, because I think they're given information that is wrong, because the people don't know quite often what they're talking about, and they don't explain to them what the problem actually is, and they don't understand themselves. And I even think the professionals that tell people that are trying to help people. They're not trying to hurt them, but I think that the idea that underestimating the child's abilities and underestimating, I think I would say that's the biggest mistake.
Yeah, yeah. And with all these kinds of children that you've seen in your decades of career now, is there a pattern in modern parenting or lifestyle that worsens the autism issues?
Well, the reason why this is all happening at an epidemic level is because of changes in our lifestyle and our environment. And there are multiple factors. My third book, called Autism, The Scientific Truth, is all about this. And there are many different factors. I mean, in my book, I identify at least 50 well-known things, like the age of parents now, things like pesticides and organophosphates and things that are in our environment, and estrogen disruptors, and inflammation and stress responses, and obesity levels. And there's so many different factors that are out there. And again, not blaming anybody for any of this, but it is being driven by environmental factors. Most people are told or led to believe that these are genetic disorders, meaning that they're genetic mutations, and they're not. And also, a lot of people are told, well, we aren't actually seeing a rise in these things, we're just recognizing it more, which is completely untrue. And everybody knows that. You just look around and just speak to teachers that have been teaching for the last 20 years, and they'll tell you how many people, how many kids, how many more kids there are. So, the only way you can explain the rise in these issues is really in environmental factors and lifestyle. But the good news is that by altering our lifestyle, especially preconception, and during pregnancy, and again, in men and women are equally have the same factors, we may be able to change the outcome and allow that child to be the best version of themselves when they're born. Obviously, when we talk about prevention, we don't want to prevent a child from being born. They're miracles. But if we can prevent them from not becoming the best version of themselves, but even so, even if we can't do it before or during birth, we can do it after birth. And so looking at diet and nutrition and supplements and, ways to keep our body clean, and all of those things around us are critically important at every stage of development, and have to be part of the conversation of how you're going to reverse this. But although they are some of the primary drivers, they're not the root problem in the individual child or person.
Understood. Yeah, yeah. I was going through some of the things that you've written, and you mentioned that you can identify brain imbalance by how a child moves. So, how true is that? Can parents also spot the signs of autism at home?
Well, we can spot developmental delays and alterations. What that's going to end up being, we don't know. But it usually will turn into being some sort of diagnosis or label. It might be autism, it might be dyslexia, it might be ADHD, it might be, a math problem, it might be anxiety, it might be depression. By the age of 3, it may show up and it may look like autism. By 6 or 7, we may recognize it as ADHD. By 10, 11, 12, it might be dyslexia or a learning disability or processing disorder. In the 20s, it might show up as schizophrenia. In the 30s, it might show up as bipolar or some other, adult mental health issue. So again, it could be anything, but we can recognize when these issues are starting, and even before birth, the movement before birth. So these things called primitive reflexes that I've pretty much published more than anybody in the world. We're the only one that's done a large randomized age-match controlled double-blind study looking at retained reflexes in children, adolescents, and adults on the autism spectrum. But we see that these reflexes are so important, and especially in humans, to guide us through the early milestones in the first year. But they come online before birth. So a baby, in the 3rd trimester should automatically get upside down and backwards and deep enough down in the birth canal so that they're in the right position for birth without the cord getting wrapped around their neck. And that should happen without a problem. If that doesn't happen, if a baby's in a breech position, if the cord's around their neck, if they're sunny side up, or if they're not deep enough down and they're not inducing birth, then right off the bat, it may be because these reflexes aren't there when they're supposed to, which already signifies a developmental delay. Then these reflexes, if they're not there, they may need to have a C-section. And if they have a C-section, it often signals that something wasn't exactly where it should be. But then these reflexes should be used to get themselves out of the womb. So especially at the end of it. So if a child needs forceps or needs unusual help, if they need to push down on the mother's belly to get the baby out, that's not the way it's supposed to happen. And why is that? It's not the mom's fault. It's that the baby isn't doing their job. And then the first milestone outside of the womb is a baby should be able to latch on and breastfeed if a mom chooses to do that. And we get about 85 to 90% of our non-speaking kids could not latch on initially well, or needed unusual help or nipple shields, or it was very painful and it wasn't, the way, let's say, it was in other children in the family. And then they need to be able to roll over 3 to 5 months, and they should like being on their belly, not scream when they're on their belly. And they should do a commando crawl in an even symmetrical way. And then they should get up and they should rock and they should crawl in an even symmetrical way. They shouldn't scoot on their butt or roll or drag one leg. They shouldn't skip any of those things. They should go through them. They should then be able to sit up and then pull up and then stand up. And right around 12 months, all children should walk a few steps, they should talk a few words, and they should clearly be able to point and have good eye contact. And they shouldn't have reflux, they shouldn't have eczema, they shouldn't have constipation, they shouldn't have terrible colic. None of those things should be there as well. So if they don't meet those milestones, it's because these reflexes aren't coming on. Once they're a little behind, even before birth, then they're more behind and more behind and more behind. And then what we've been able to show is that all of these reflexes should go away just when they hit those walking, talking, and pointing milestones. And if they don't, why? It's because these reflexes haven't gone away. And if they haven't gone away, they don't go away on their own, and they will stay there, and they lead to a delay. Now they hold back brain development, and they lead to an imbalance one way or the other. And that's superimposed on the child's natural gifts that are family traits. And that we can see right from the beginning. So again, right from the beginning, we can intervene and we can get the child back on track. because the further they go off track, they keep on just
Yes.
going that way.
Mm.
And so we don't know, and we can't say, what is this going to be? Is it going to be autism? Is it going to be something else? But we do know that there's a
Could be something.
problem,
Yeah.
and they're not becoming who they're supposed to be fully.
Yeah.
And that the further they go down the road, there's going to be something that shows up, or they're not going to meet their ultimate potential, which is also, even if they seem perfectly normal. And again, a child should also, even if they look like they hit those milestones, they should never regress. And these regressions are also due to when these imbalances fully kick in.
Yeah.
And especially when the left brain comes online too early, it crashes that right brain. And that's when a child stops answering their name, or looks like they may be deaf, or, and if there is increased inflammation in their body and problems with their digestive system, which is going to happen if this is happening, then that inflammation now makes it worse. And now, anything might be like throwing a match on a, and so even a vaccination might trigger that inflammation even in more. And all of that may come together as a perfect storm that causes the child to regress and lose many skills that they seem to have gained.
That's actually so well explained, because this question comes very often. And if you could answer this in maybe one or two sentences once again in very simple words, because we get to hear this a lot, Dr. Melillo, that my child was absolutely fine till about 18 months or 2 years. What suddenly happened? He's talking a few words and then suddenly he just stopped doing everything that he was doing. The second thing that I hear is, we move forward 3 steps, we come back to. Then we go up 4 steps, we come back to. So that's again regression. So can you tell me, why does regression happen in autism?
Yeah, well, I just described, really the best way. But first of all, to be honest, I've worked with tens of thousands of patients, and especially with my centers. And I've almost never seen a child that is fully, if you really go through the milestones from pre-birth movements, the birth process, to all of those things I just went through, and including speech and pointing, you very rarely, almost never, get a child that really actually had normal. But I do, most of the parents come in and they'll say, everything was fine in the first year and a half. And I go, okay, wait, well, let me go through it with you and analyze it step by step. And it's because pediatricians don't pay attention to that. And they're not really focused, and they don't really understand how important it is. And so therefore, they generally look at it and go, oh yeah, everything was normal. Or other doctors will say it was normal. Or they'll go to another doctor who's doing a history and they say, how is the milestones? And the mom was told, well, the milestones were all normal. And they say, well, it was all normal. Nobody ever really looks at it, but it's never normal, right? So that's, first of all, it's always there. But then when there is these imbalances, again, what we see is that the right brain should develop first in the first 3 years by about 20-30%. It shouldn't be much higher than that. And the left brain then comes online for the next 3 years approximately. And that is very critical to what creates the difference between the right and the left brain. And that sequence is all part of that. And it happens totally outside of the womb, right? So what we see is that in autism in particular, when those reflexes don't go away, and if they're not fully reaching their milestones, and the bottom line is, even if it looks like they reached the milestones, if those reflexes are still there, they didn't. It wasn't the way it was supposed to be. So that's why just checking for the reflexes. We have a paper that's going to be coming out any day in one of the top clinical pediatric journals in the world. And this has been one of my campaigns for 20 years. Just trying to get pediatricians to look at primitive reflexes and look for retained reflexes as a marker of a developmental delay.
Yeah.
And they don't do that. But now, finally, we got a major pediatric journal reached out to us and said, all right, a lot of people are now asking questions and are coming to us about this, primitive reflexes again. And we went and looked and said, where's this all coming from, this interest? And they traced it back to me and my work, because if you go on PubMed and you look at retained reflexes, my paper is number one. And so they said, so first they asked us to write an editorial letter. And then they said, you know what, there's too much interest. Can you write a whole paper on this? So we did. And that paper is coming out. And it's basically entitled, Looking at Retained Primitive Reflexes as a Biomarker of Developmental Disabilities. And if we can just change that, it will make a huge difference. But so understanding that if the reflexes aren't there, and then whenever there's this delay, now it holds the brain back. This is just when the right brain should be going into its peak of development.
Yeah. Hmm.
And so now the right brain is impacted more than the left. And now if you get a child that's unusually gifted in their left brain, it comes online too early. And now that, as it gains power, it pushes down the right. And then around 3, the left really kicks in, and then it can crash that brain. And anywhere in that period, it can regress. And we see this because we see early left brain skills. We see many of these kids are learning words early, maybe before they lose them. They can read early. They can memorize books early, or they're really interested in books and letters and numbers, or they can read signs, but they can't speak. Or we see overactivity of left brain networks like tics and stimming, or OCD, or anger outbursts, or repetitive behaviors. That's all the left brain's coming online too early and the right brain is delayed, like in toe walking and not feeling their body and not feeling pain and not being able to be potty trained and not, smelling. So that's where the regression comes from. And that's why they lose this connection. They lose this self-awareness. And that's when they're learning that they're starting to learn, I'm a self, I'm an individual, and they won't fully kick in until around 2 when they recognize themselves in a mirror. But then what happens lots of times with that regression, parents say, they stop responding to their name. Why? Because they stop to evolving into an individual person, and they lost that sense of self and self-awareness. And so now, if you don't have a sense of self, you don't have a name, right? And that's where the regression comes from.
Yeah, that's amazing.
If there's inflammation at the time, right? So if there's a vaccine that might trigger inflammation more, then that might contribute to it as well. But it's not the primary problem or the primary source.
Yeah, this is amazing. I mean, I know we have less time, but I want to ask you this last question because I know you work on this. That is exactly what Melillo method is. That you know that the right brain hasn't progressed that much as the left, and left is just overtaken. How do you use the method to get a balance?
Well, we've created a complex but easily reproducible system over my career, and this has been the ultimate evolution of what I've done. And we use multiple modalities. So the first thing is we need to get rid of these reflexes, and so we will stimulate these reflexes in the child or the person or the adult, and we train the parent to do it over and over to bring them on and let them go away, which then removes that main. Then we need to balance the brain. And we do that by using a combination of all different types of sensory modalities that activate one side of the brain and bring that up, which allows it to inhibit the other. And then we use different brain stimulation tools like, transcranial electrical stimulation or TENS stimulation or photobiomodulation, laser light therapy, or we may use other types of tools to quiet down or slow down, because the biggest obstacle is that left brain comes online so strong and it's so powerful, it doesn't want to give it up. And everything they're doing is feeding their left brain. They're running back and forth, jumping up and down, moving, stimming, ticking, technology. They're just feeding that left brain. And it's really hard to overcome that, but we can overcome it. And when we combine enough modalities and get a leverage point and do it with the proper frequency. And then, our goal is to create maps. So we get them to move in better ways, in more complex ways. And we use, things like vibration. We use virtual reality, video games. We do academic training. We do, again, different forms of speech or communication training. We do neurofeedback if we can. We then wrap that all around with very high level neuroimmunology to reduce inflammation and balance out the Th1 and Th2 system, and reduce their antibody levels and improve their ability to fight off infection, and to provide them with the nutrients that their brain needs, because all of this and the reflexes prevents the parasympathetic, the rest and digest system, from coming on, and it keeps them in a sympathetic dominant state, which is why they have a leaky gut and poor digestion and malabsorption and low enzymes and acids, and why they have bugs in their gut that they shouldn't have. That is all important, but that's not the primary driver. Inflammation is not the primary driver. It is secondary to the brainstem development and the balance of that sympathetic and parasympathetic nervous system.
Yeah, very well explained. I just loved it. I just loved today's session. And I think there is so much more. We don't even have time for it, but maybe sometime next time. But I have personally gone through the Melillo method, and I know you work on balancing both sides. And it's just very exciting to understand the ways you can do it. And once you achieve it, it is very obvious that you will see changes in the children. So
Yes, we get tremendous changes, and again, because it all started with asking questions as a parent of children that I don't think anybody asked and certainly couldn't answer, and it's been a lifelong search of trying to come up with those answers to be able to turn them into practical solutions. And I have the course that I've taught, and people are certified. And that is a basic, very simple version of what we do. But then in our centers, we do a really sophisticated version that we've been working hard to evolve. And, we just shot like 350 new videos just to train our staff. And we have very clear training and testing procedures and standards. And we hope to be able to share that around the world soon, because that's the ultimate version. And I think there is no program out there that is comprehensive or really, works with this in the way that we do.
oh, it's amazing. Thank you so much for your time today. I know that it's going to be 11 at your end, and you have your appointments coming up. So thank you so much, Dr. Melillo.
And thank you. And thank you for what you do, because your products and what you do, I've looked into that as well, and it's very important. And you're doing such a wonderful thing, and being out there. You could be doing a lot of other things, but here you are, trying to help parents and children. So, that's why I just am grateful for other people like you, because, that's how we can create change.
Yeah, yeah, yeah. Thank you so much. Thank you.